everybody, it's Kelly Casperson. I am a urologist, and today I wanted to show you vaginal estrogen. So this is a tube of estradiol cream. This is the generic. It is estradiol 0.01%. It's the only percentage that you can get. I am a practicing urologist in the United States of America, so everything I say is American-based. Some countries don't carry the generic. Some countries it's over the counter. Wouldn't that be great? A girl can dream. But currently in the United States of America, this is a prescription. The reason is because it's a hormone, which is regulated by the FDA, and it is prescription only, so you need a doctor, nurse practitioner, physician's assistant, etc. This is one tube of 42 grams. It really only comes in one size, one percentage. It's kind of easy. Now, you can get vaginal estrogen in other formulations. You can get it in tabs, Vagifem. You can also get it in a ring called Estring, or you can get it in the cream. There's two options in America, brand name Premarin, which is conjugated estrogen cream. Sometimes that's cheaper, but a lot of times it's more expensive. Then there's the brand name Estrace, which is just estradiol, but brand name. I don't recommend it. It's very expensive. And then number 3, my favorite, is the generic estradiol. So when you go to see your doctor or provider, make sure it's the generic. It's going to be the cheapest. Next thing to do is to go on your phone and to get the GoodRx app. The GoodRx app shows you what cash price is in your town. You have to type in estradiol vaginal cream, the 42.5 gram tube, and then you type in your zip code. It'll tell you the cheapest. There's no reason to be paying over $100 for this ever again. It is generic and cheap, but you might have to go to your pharmacist and say, I want to pay cash. Here's my coupon on the GoodRx. Don't charge my insurance. It's yesterday when we thought that insurance was going to give you the best price for your pharmaceuticals. It is not that case anymore. Oftentimes, cash-based, not using your insurance, is going to give you the cheapest. It's pretty rare these days that you have to get it compounded at a compounding pharmacy in order to get the price lower. Now, I really do recommend the FDA-approved component of the vaginal estrogen. The only reason that you'd want this compounded is if you're sensitive to the base. It is an alcohol base, and especially for really dry skin or sensitive skin, pretty common to have a couple of weeks of sensitivity, especially if your skin is very sensitive, but that does go away as the skin heals, and I tell people you literally grow healthier skin. This is like skincare in your face, except for it's in your vulva and your vagina. So if you are noticing that it's a severe burn and just does not get better after a couple weeks, try the compounded. They can oftentimes take that alcohol base out and put it either in like an olive oil base or something that is a little more natural, or at least get the alcohol out of it. Versa base, Versa, is a nice base that can be compounded with the estradiol cream for people with really sensitive skin. Now, you say, what do you like? I like the cream the best because you can put the cream on the vulva. That 6 o'clock area of the vulva tends to get very tight, torn, tender, especially with sexual intercourse. You can rub the cream there, as well as the top of the vulva where the clitoris and the clitoral hood is, to help decrease adhesions, to help keep good blood flow and collagen to the skin surrounding the clitoris. That's why I love the cream. I don't think you're going to get that as much if you use a tab just in the vagina. But certainly if all you're trying to do is get a healthy vagina to possibly decrease your risk of urinary tract infections, remember, vaginal estrogen post-menopause in some studies decreases UTI by 68%. It's awesome. Everybody with recurrent UTIs, rebalance the pH and the microbiome of your pelvic health with vaginal estrogen after you take those antibiotics. It's a nice preventative medicine. Really, I want to start seeing it as level 1 evidence for recurrent UTI. We're almost there. It's certainly in the guidelines now for urology for recurrent UTI, which is awesome. So now I want to show you the applicator. You can use this just on your finger like this for your vulva, clitoris, vulva. Just use, this is like a pea-size amount, but the actual prescription is 1 gram per vagina twice a week. A lot of people will do the loading dose, which is once a day for 2 weeks, then backing off to 2 times a week. I think that's officially how the prescription is written. I think it's hard for people to understand that. I think it's too much too soon for people, especially if they have that sensitive skin. You want them to kind of not have a lot of side effects, so they continue to use this. I don't love using the loading dose for those two reasons. I just tell people twice a week until you die. And they say, can I ever stop using this? And I say, yes, if you want your symptoms to return. So now I got to find my applicator. This is an applicator. If your prescription didn't come with an applicator for whatever reason, or you threw it out because you didn't want to use it, I wasn't having people use applicators a couple of years ago. And the reason for that is because the product was so expensive. I just wanted them to like use as little as possible for what they needed. Now that the prices really come down, I'm seeing a lot of these people back and they are still getting UTIs or still having pain with sex. And I'm like, go back up on the standard dose again, 1 gram per vagina twice a week. I just think they were underdosing when I was telling them to use a pea-size amount. So I certainly have changed that recommendation over time. But so it's an applicator and it can come apart. What you can see on here is gram, 1 gram, 2 gram, 3 gram, 4 gram. You're going to fill it up to the 1 gram line. I don't know why they have more than that. Because it's rare that I see something unless you're doing something specialty. So what you can do is you can put it on there and you just squeeze gently as you pull back to the 1 gram on here. So you can see it's kind of like to there. It is a very small amount. Put it in like a tampon at the top of the vagina. If you put it up in the top of the vagina, and especially right before bed, it tends to not be very goopy. If it is goopy the next day, I'd say, are you not putting it up high enough? Are you using too much? Maybe back off a little bit. Certainly, I would rather have you troubleshoot this than just stop, right? Because we know that genital urinary syndrome of menopause, GSM, formerly known as vulvovaginal atrophy, is a progressive disease. It will continue to get worse with age. It'll continue. So if you don't take good skin care, it'll just get worse and worse. How common is this? GSM, 50 to 80% of women post-menopause, really starts kicking in 5 to 10 years after the start of menopause, again, defined as 1 year of no menstrual periods, but certainly a lot of perimenopause, around menopause. I'm still getting my period every once in a while, but I have pain with sex or dryness or itchiness or increased bladder urinary urgency frequency. You can use it in that perimenopause. I see it very commonly. So I would put this up in the vagina, squirt this like a little tampon, and then do a little bit more, or just take what's around the excess for clitoris and vulva. Use a mirror for a while till you get the hang of like where all these structures are. No shame in making sure you do this right. Skincare is a $1 billion industry. This is just skincare, pelvic health, bladder health, vulva, vaginal health. I see a lot of women, they're like, I'm not sexually active. Do I have to use this? I'm like, you're not doing this for your partner. You're doing it for you. You might be sexually active in the future. Who knows? Maintain great skin. But it does really help decrease your recurrent UTI risk, dryness, dysuria, skin thinning, irritation, sensitivity with wiping. It's, again, just skincare. So I don't really care if you're sexually active or not. I don't think vaginal estrogen is just for this sexually active population. Another important question about vaginal estrogen. Vaginal estrogen is not considered HRT, or hormone replacement therapy, in the way we think about systemic hormones, full body hormones, oral or patch estrogen hormones. So if you're just using vaginal estrogen, you do not need to be on a progestin to protect the uterine lining like you do if you have a uterus and you're taking systemic estrogen. Vaginal estrogen, a whole year's worth, is equivalent to 1 pill of oral hormone menopause therapy. So it's incredibly low dose. The association with breast cancer is 0. The association with any other cancer or badness is 0. It is mislabeled on the packaging. The packaging does have the same concern and risks that systemic estrogen, so same reading as if you were on birth control pills or if you were on hormone menopause replacement therapy. Again, the data does not support any risk of breast cancer or any other of those risks with estrogen with vaginal estrogen. So much so that ACOG and cancer survivorships fully authorize vaginal estrogen use even after treatment with breast cancer. Even with treatment, if you're currently undergoing treatment for breast cancer, I would say consult with your doctor and your oncologist, but more and more we realize quality of life and survivorship is very important, and the risk of vaginal estrogen is incredibly low. Another question I get, especially with the sexually active people, is ideally you're not going to get this on a male partner. It's still really, really low dose if you are, but I'd say this is twice a week. See if you can spread out those sexual activities and events just so you're not putting direct vaginal estrogen cream on a male partner. That's an ideal world. But don't be afraid. You can still be sexually active. I just wouldn't directly apply it right before any vaginal sexual activity. So how long does this take to kick in and work? Takes about 6 to 8 weeks for maximum benefit. Remember, this is not a band-aid. This is literally creating new skin, getting you the healthier skin that you had when you had a good amount of estrogen in your body. So it might be a little irritating. You might have some side effects in the beginning. Those should back off as that skin becomes more resilient and healthy. And then you shouldn't have any side effects. If you do, ask your doctor, do you need to go on a different lower dose? Do you need to get a compounded product? But really effective is going to be about 6 to 8 weeks after you start. And you do need to continue it for life. I always say it's like sunscreen. Like, doctor, do I need to keep wearing sunscreen? They're like, well, only as long as you don't want to have sunburn, right? Only as long as you don't want to have the bothersome side effects of genital urinary syndrome of menopause. Again, 50 to 80% of women, vulva owners who are past menopause will experience this. I think vaginal estrogen, you should turn 50. You should just say, here's your mammogram, here's your colonoscopy, here's your vaginal estrogen. Western medicine is very bad at preventative health. We only want to treat disease. We aren't as good at preventing disease. We don't have a lot of data to say that this should be a preventative medicine, but certainly what I do with my job every day and seeing over and over and over, genital urinary syndrome of menopause, women don't even know that's what it is. Usually they're treated with anti-yeast meds a lot, antibiotics over and over, till they come to see me and I say this is because of estrogen deficiency. So that is my vaginal estrogen episode. I've been dying to do this for you guys because I get questions all the time, and now I have a great resource for you all. So love you so much. God bless. Go get your vaginal estrogen. Pay cash. It might be cheaper than insurance, and you do not need to take a progestin or a progesterone product when you're just taking vaginal estrogen. Hope it helps. Love ya. See you next time.